Michael Spencer, thanks for coming by and helping us wrap up the day. You're the
Absolutely.
wrap up. You're the one. You and I are standing in between us and cocktail hour, right? We've reached that point of the day. So thanks for joining this. I've enjoyed getting to know you a little bit. We clearly share an equal passion. I'm a self-confessed revenue cycle geek for many years. Obviously, I sort of have to solve all the problems of the revenue cycle with our clients through data. But I think woven throughout the day today, I don't know, probably half the discussions were patient access, front door of the revenue cycle. So you have a pretty big job at a client of ours, Conifer, and your career's in multi-billion-dollar health systems, and you have spent a lot of your career in the front end, right? It's the front door. We share an equal conviction, which is why is it sometimes it gets put on the back burner. It has delays. I don't want to be, too provocative, but why doesn't it get more attention, the attention it deserves in your mind? Like, let's start there.
Yeah, I think in my experience with 3 major health systems that I've been in, in 20 plus years, that health systems are going to invest where the revenue generation happens, right?
Yep.
So the new MRI machine, robotics, etc.
Yep.
More patient beds, right?
Yep.
Expansion. And I understand there's a place for that,
Yep.
especially in a fee-for-service environment that we live in.
Yep.
Obviously, I'm a little selfish on what scope of that benefits or does not benefit the work that I do and the service that me and my teams provide to our patients.
Sure.
And in front-end revenue cycle, patient access, patient services, whatever you call it, there's a clear and present need to be able to meet our patients where they're at.
Yeah.
And our patients demand more because of the experiences that they're having with technology-forward organizations in and outside of healthcare. I mean, Amazon, et cetera. There's an app for everything now.
Yeah.
And yes, I think that in general, healthcare organizations are doing a fairly good job, better job now, thinking about RPA, AI,
Sure.
machine learning, et cetera.
Yep.
More so that applies on kind of mid and back end revenue cycle, things that will help with computer assisted coding, with claims processing, or triaging a denial and trying to get that bucketed appropriately to an individual to review, or even hands off, completely send that back to the payer with some additional documentation justification. But still, I find myself in my world trying to advocate for our patient and advance the technologies that we utilize for our patients.
Yeah, absolutely. It seems to me, and just in our dialogue, for how many years have we been saying patient first, patient in the center? Do you feel like we've turned the corner, and that because you're being backed by your C-suite around your initiative is digital patient engagement?
Correct.
Right.
Yeah, that's what we call it within Conifer, is digital patient engagement.
Yep. It's very clear to me. Yeah.
Mm-hmm. Right. What the scope of that means within our interaction with the patient. You mentioned patient surveys.
Yep.
Just to comment on that for a moment. Yes, for years, and everybody still uses HCAPS, right?
Yep, sure.
And there's different vendors out there. In my experience, with the organizations I've worked with, it's primarily been through Press Ganey.
Yep.
I've never really liked the way that the questions are worded.
Yeah.
We perpetually have issues with patients confusing who the subject of the question.
Yeah.
And they'll answer a question, negatively, that's patient access oriented, but then write in verbatims about how the nurse was whatever, or the doctor was whatever, or the room condition was dirty, etc.
And since it's a survey, it has to be somewhat standardized so that it's benchmarkable and all that. Right. But you're right. So that can be problematic. So to address that, I'm just curious, do you do your own?
Yes.
Okay.
And so to kind of peel back the layers of the onion, what is digital patient engagement?
Yeah.
What does it do?
Yep.
What are some of those specific features and functionalities within it as we define it?
Yep.
So our initiative right now is focused on basically everything from order through point of entry. And let me break that down into a few specific segments. So we may receive an order from a physician. We could use digital patient engagement to reach out to the patient to help get that appointment scheduled. Or if a patient has an order in hand, right? And this is somewhat duplicative with what other systems do today.
Sure.
Yes, patients can do self-scheduling
Yep.
through some patient portals.
Yep.
You know, of course, we can talk about patient portal utilization and how that's low.
Yeah.
But I'll get into some of the kind of pros and cons and
Sure.
how rules
Yeah.
of engagement.
Yeah.
So self-scheduling.
Yep.
It includes texting and or emailing the patient ahead of their scheduled visit.
Yep.
And sometimes multiple times as we get closer to the scheduled
Sure.
data service. They're able to log in without a user ID and password, some just dual authentication or ID validation. And then they go through a full demographics review that's in a form that's preloaded with whatever we have on file. So not completing something from scratch. Think about you go to your doctor and you're given that clipboard.
Yeah.
Once a year,
My
you
gosh,
get this
still.
clipboard. I've been a patient here for years, and I have to fill out everything as if I've never been here before.
Exactly. Couldn't agree more.
So in addition to that, so digitally on your phone, you can do this on a computer, on your phone. Doesn't require an app to be downloaded. Doesn't require a user ID and password. Those are barriers of entry, barriers of utilization.
Good point. Yeah.
And that's exactly why we as an industry struggle with patient portal utilization.
Yeah.
Because you have to have an app or a user ID and password.
Yeah. Yeah. And then they kick you out, and we all have to take cybersecurity very seriously. But sometimes the app, you're right when you need the portal, you got kicked out, and you have to reset your password. It's like, I don't have time to do that. I'm here. You know,
different password requirements for every system.
Yeah. So the text thing, I want to make sure we don't gloss that over, because I have found it to be helpful, like with dental work. I would say that I say this all the time, that dentists seem to be more on the ball with that, right?
Yep.
So you have an appointment. It's like, I can hit one. Are you still coming? Yep.
Right? Confirm your appointment.
And they may do that 2 or 3 times because they know that I'm going to reschedule 100 times because I travel, blah, blah, blah. I actually find it to be, and the easier it is for me, yep, I'm still coming. Or, hey, nope, need to reschedule, call, right?
Mm-hmm.
We all have the phones, so low common denominator principles, right? Using form factors that people have ready access to. And like you said, taking friction out, fewer touches, fewer friction points that's what patients are demanding.
Absolutely. A few other functionalities of the tool that really, because this is not just about taking an interview that we do with a patient over the phone and converting it over to you doing it yourself on a website. We're looking at pushing additional capabilities. So capturing an ID and an insurance card from a patient on their phone. So literally pull out your wallet, point your phone at that ID and take a picture front and back. Signing your consent forms on your phone before you arrive.
Everybody wants to do that. We use online banking. And
we're doing it today now in Conifer.
Yeah, that's great.
And all of that means nothing if you can't actually deliver something of value to the patient at some point in time, because we're asking the patient to do more up front. So we have to return that favor to the patient later on.
That's a good way to put it.
And the way that we do that is creating an expedited, streamlined check-in process for the patient. Now, there's some things we can't do. I mean, ideally in a perfect world, and maybe in a clinical setting, we could do this or a non-hospital setting, let me say that, we could do this. is completely bypass registration. Completely.
Sure.
If we have your ID, your insurance card, demographic verifications, signatures, your payment also processed pre-service. There's nothing holding you, in line. But we still live in a world where we have to have armbands.
Yeah. Yes.
So, but that's what we're trying
Yeah.
to limit this down to is you check in,
Yeah.
and it's just as simple as ID verification, put an armband on you, and send you on your way.
Yeah. So let me ask you this: that's got to be a big investment, and but clearly, you can understand the value from a macro standpoint. But like, how are you going to measure success? So like, you put dollars into digital patient engagement, because I think sometimes, there's hard dollars and there's soft dollars. Satisfaction doesn't always have like a perfect correlation to hard dollars. But if that's what you're trying to do, if you want to build patient loyalty, right, in this, at the zip code level, then it takes that kind of investment. It's like marketing departments. How do you measure marketing effective? It's very, very tricky and nuanced. So I imagine, for you, it's the same way. You got certain things that you can probably ROI with hard dollars, but there's also a cost to loyalty, and there's a cost to avoiding network leakage. So this should be one of the most funded things in my view.
It should be. I think the ROI is very clear in principle to the benefits that this brings to any healthcare organization. But as anybody knows who's tried to push a project in, you have to show it on paper,
Sure.
the potential. So
Sure.
now I'll start with what's maybe a little more gray and
Yeah.
difficult to measure. And you mentioned that, and that's patient satisfaction.
Yep.
Yes, there are studies out there that show traditional, or at least tied to traditional HCAP surveys, that a 2-point improvement with this measurement, more likely to recommend, for example, can yield X number of millions of dollars in net
Sure.
patient revenue.
Yep.
That's a little more soft when you're talking specifically about patient experience improvement with something like digital patient engagement.
Yep.
But at least we can show that there's a correlation, not
Yep.
necessarily a causation directly to revenue uplift.
Yeah.
Now, there are definitely some more black and white and direct ROI arguments that could be made. The biggest one, and probably the most easiest, is efficiency gains.
Yep.
Right?
Sure.
And we didn't really talk about this earlier, but the only way that this becomes digestible in a healthcare setting with a complex, RCM
Yep.
organization like ours is that you can introduce more systems that require more manual processing,
Yep.
that require another touch point for our staff.
Yep.
And so we have been very particular about fully integrating these. Now, I mentioned before, form that you're sending a patient demographic form, you want it to be pre-filled. But this is not just about having a unidirectional ADT integration.
Yep.
We need full bidirectional integration.
Sure. Yeah.
So instead of me calling you, I'm
Yep.
the registrar, you're a patient, and going through all the questions and updating that in the
Yep.
computer, instead all of your updates flow directly in.
Yep.
Your insurance card flows into document imaging, consents flow into document imaging,
Yep.
payment is processed in our payment vendor solution.
Yep.
And our workflow tools that every organization has a way to track work queues and workflow, but those tasks are completed within those work queues.
Yeah. Yeah, for sure.
And then that way, and only that way, does it actually simplify, not only for the patient, but for our staff, the work that they have to do on each and every account.
Yep.
So now back to where I left from that tangent. Efficiency is only achievable
Yep.
with a true deep bidirectional integration with digital patient engagement solutions.
Yeah, I know, and it's one of those things where I find the bidirectional for everything. Things get prioritized in the clinical side of the house.
Yep.
And it's like, guys, do you know what it costs us when we don't have systems talking to each other? So we have to start just saying, like, look, It's a cost of doing business. There is no one size fits all. There's no one platform.
Yeah.
So it's a good point that we should, it's easy to talk about shiny objects in innovation, but sometimes the stuff like pipes and plumbing and making sure that bidirectional feeds are flowing, that's as important, right?
Mm-hmm.
Because you're not going to get the ROI if you still have semi-manual data flowing everywhere.
Right.
Yeah.
You brought up earlier that this with your dentist, you can click on a button and confirm your appointment. This technology isn't new to the broader healthcare spectrum. In fact, most consumers of healthcare have experienced this in one form or fashion
Sure.
with their PCP or a specialist or their dentist.
Absolutely.
Right?
Everything that, yeah.
But why isn't it as common in acute care settings?
Yeah, in big hospitals, yeah.
And it's because of multiple system integrations that are needed.
Yeah.
It's easier in a practice where you have, a physician who uses a single PM system, and there's one integration point, and that's it.
I just think it's a lame excuse because the larger the enterprise, the more you have resources, and so I'd rather poke the bear a little bit and say, like, come on, get on with it. We have multiple systems. It's going to cost money to make them talk to each other. Spend the money because you won't get the ROI and the value if you don't.
Right.
So they're making us wrap up. Let me ask you this: in your purview and this initiative, where do you want to be in 5 years?
Personally, or as an organization?
As an organization, yeah. Where do you want this investment in digital engagement?
It should be live at all of our hospitals across all of our clients. Every patient should have the opportunity, whether scheduled or walk-in, unscheduled emergency room, to be able to choose to use digital patient engagement technology, or if they so choose, we're happy to take care of them.
So you're going for 100% implementation and adoption in 5 years?
We'll be there before 5 years,
Great.
well before 5 years.
Great. That's great.
Yeah.
And it's, these things take time, especially the larger the organization. You guys are a big shop. It touches multiple people.
Mm-hmm.
Well, that's great. Well, thanks again. I mean, not only did we get kicked out of the show,
They're shutting the lights off.
They shut the lights off. They apparently want us to go to the bar, Thanks a lot.
Thank
really
you so much.
appreciate it. Yeah.